Good morning. Today we'll be doing the unit-wise questions on the use and abuse of drugs. In this chapter, we'll encounter many graphical questions in which we'll have to interpret the data from the graph using the knowledge we have before, and the correct interpretation of the graph is very important. So, starting from question number one, if you see carefully see, they have shown that the number of smokers or the percentage of smokers has slowly decreased 1950 onwards. However, still the number of deaths from lung cancer have increased from 50 to 75. So they asked, why is this opposite relationship or paradoxical relationship? That is because the number of deaths have increased because the people have stopped smoking after 1950. However, those people who had been smoking before 1950, their deaths have now increased from 1950 to 75. And so, because of the decrease in smokers after 50, you can see this slowly downward trend after 25 years from 75 to 2000. So, the answer is that a higher number of smokers before 1950. Now, what is a penicillin? Penicillin is an antibiotic which is used to kill bacteria, and it is basically made from a mycelium, which is a fungus. In question number three, they have asked the production of penicillin. In order to make penicillin, we always have to maintain a specific temperature as well as pressure. However, if we talk about the labeled X, we'll get to know that it's just to monitor the and maintain a constant temperature of the fermenter. Now, we all know that alcohol is a socially acceptable drug. However, only moderate amounts of alcohol are socially acceptable, and large amounts of alcohol depress the CNS as well as increase the reaction time. It is broken down by the liver. However, excessive amounts of alcohol are very harmful for the liver and can lead to liver cirrhosis and further damage to the liver, which will inevitably lead a person to have organ transplantation. So the alcohol acts as a depressant. That's true. It's broken down by liver. However, it decreases self-control. So this is incorrect, and it increases the reaction time. For example, if a person reacts to a incoming car's flashlight in about 2 seconds, it would be increased to about 8 seconds. That's why alcohol was first people are not allowed to drive cars while drinking alcohol. Now, in this question number five, they say that the mycelium divides in a specific amount of time. The most amount of time is required by starch, so it's a reasonable inference that penicillium takes longer to digest starch than to use sugars. Now, which disease can be cured by antibiotics? Only bacterial diseases can be cured by the antibiotics, not fungal or viral diseases. So syphilis is a sexually transmitted bacterial disease, whereas HIV is a viral disease and lung cancer is caused by radiation. So only syphilis is treated by antibiotics. Yes, answer now. Emphysema. What is emphysema? Emphysema is when the structure of the alveoli is damaged in such a way such that its overall surface area is reduced. And because overall surface area is reduced, there will be less efficacious gaseous exchange. Because gaseous exchange in the human body occurs by the process of diffusion, and the greater the surface area, the more quicker the diffusion of process occurs. So as you can see that the normal shape has been completely destroyed, and what will be the effect of emphysema? That there will be less efficient gaseous exchange. And now in question number eight, again, which statements are supported by the data in the graph? The relatives, the yeah, so number one and number two can be supported from the graph because it depends on the numerical data. However, the risk of lung cancer depends on the tar content of the cigarette smoke. Although it may be correct, however, the tar content is nowhere mentioned in the question, thus we can't make this inference on our own. Now in question nine, which they say what could not you have the trick in the exam is that you have to clearly look at the option which has been written in bold. Now they said what could cannot. Obviously, when we can see that the number of deaths in country Y are far greater than almost double the amount of deaths in country X. So what can be the plausible reasons? Saturated fats, yeah, that's likely outcome. So it can option D is ruled out. Lower average age, yeah, so people below 50 years of age have less chances of dying from coronary heart disease, so that's cannot be also be correct. And also less smoking. However, see more males in country. Why? That isn't a plausible reason, because so C cannot be our answer. Although males are more males are more susceptible to have a heart attack because they have no estrogen content in their body, and premenopausal women have estrogen which protects them from having a heart attack. However, after menopause, the amount of risk which is imposed on women is almost the same amount of risk which is imposed on men to die from coronary heart disease because of decreasing levels of estrogen. Now, question number 10. Gin is also a type of alcohol. This is 40% alcohol, and if a person drinks a large amount of it, obviously his muscle control will be reduced, and the overall CNS reaction time will also be reduced. Now, in question number 11, again we have to show from the graph. In question 11, they say what is shown by the bar chart. Smoking, yeah, so smoking in pregnancy increases the risk of low birth weight. Although other options may also be correct, however, we have to select the option which can be reasonably inferred from the graph. For example, if a person does not know the pre-existing information, you can still infer that the number of percentage of a woman having low birth babies with low birth weight considerably increases in those who are smokers. Now in question 12, again, alcohol causes liver damage. That's correct. It's a depressant. However, it increases the reaction time. So yeah, B is correct. Now, which component of cigarette smoke is the main cause of lung cancer? Although all four of these components are present in cigarette smoke, however, the one which is causes lung cancer is carbon monoxide. And another thing about carbon monoxide is that it's known as the silent killer. Often in home appliances and in gas heaters, carbon monoxide is an odorless gas, and in cases of gas leak, many people die from carbon monoxide poisoning in their sleep. Now, in question number 14, which substance is the cause of change in heart rate? So, we can see it from 10 to 18 minutes, there's a sharp, steep increase in heart rate. And the only substance that can be responsible is nicotine because it acts as a stimulant, and it increases the heart rate. Question number 15, it's again the breakdown of the elastic tissue in the walls of the alveoli. The condition is emphysema. In question number 16, we need to know that heroin leads to addiction and it is a bad drug. Now, so heroin has addiction, carbon monoxide causes emphysema, and alcohol causes liver damage and increased reaction time. However, the best option is B because carbon monoxide it causes emphysema more and it doesn't cause any addiction. Now, why it causes I told you about carbon monoxide, why it is known as a silent killer and how it kills a person is that it has greater affinity for hemoglobin than oxygen has for hemoglobin, and thus it might binds about 8 times more with hemoglobin that oxygen binds. So, since all the hemoglobin is bound to carboxyhemoglobin in the form of carboxyhemoglobins, there is no oxygen left to be able to distribute to the tissues of the body and especially the brain, which dies within a span of minutes. Now, after 1960, we can see that smoking was becoming less socially acceptable because the number of people who are smoking are decreasing. Fewer people were dying of lung cancer, though it can be reasonably inferred. However, such data hasn't been showed about in the graph, which is describes the problem of using antibiotics. Yeah, overuse of antibiotics without filling the course properly. For example, Azomax is to be given 5 days. The person takes it just for 3 days, or over prescription of it causes antibiotic resistance because they develop resistance mechanisms to counter the antibiotics. Although other options can be correct, but this is its problem. Other things are only facts. Antibiotics have no effect on viruses. This has been known since day one. Now, on question number 19, they say that the option which can be reasonably inferred is that people smoking 5 cigarettes a day live longer on average than those smoking 15 cigarettes a day. The comparison it is between cigarette smoke per day and average lifespan. So it has shown that the lesser the number of cigarettes you smoke, the greater is your lifespan. Now, the major effect of nicotine, it activates the sympathetic nervous system, and it is also a stimulant. Apart from that, it leads to addiction, so it increases the desire to smoke. A person who takes a fixed amount of say cigarettes each day, he has to take more and more to achieve his craving. Now, in question number 21, the amount of cleared area corresponds to the amount of bacteria killed. You can see that, and there is far more cleared area in W than X, so it can be inferred that W is far more effective than antibiotic X. Now, when an antibiotic is most likely to be effective, whenever the infection is caused by a bacterium or fungus. Yeah, that's correct. Now, in question number 23, excessive consumption of alcohol, we talked previously as well, that liver cirrhosis. Why? Because the liver acts by as a metabolic pathway, and it helps to oxidatively deaminate all the toxic metabolic products. However, when there is excessive consumption of alcohol, it leads to liver cirrhosis and fibrosis of the liver. What was the cause of the sore throat? The doctor, they say that the doctor examined the patient and he prescribed it an antibiotic. Obviously, the option would be bacteria, since antibiotics target bacteria. And just for your information, the most important cause of sore throat is Streptococcus pharyngeus. In question number 25, what can be concluded from the data? People who smoke have a higher chance of getting lung cancer. Although option D is correct as well, and this is just, you need to know that option D is a distractor because they have talked about numbers. And although lung cancer, 90% of the people who get lung cancer are from smoking. However, people can get lung cancer from other causes as well, such as the daily smog, and you've heard about the rising amount of pollution in our environment, as well as other pollutants which are emitted by the motor vehicles. Thank you. This ends our video on use and abuse of drugs. I hope to see you in the next video soon.